أعوذ بالله السميع العليم من الشيطان الرجيم بسم الله الرحمن الرحيم نحمده ونصلي على رسوله الكريم أما بعد. Welcome again, dear viewers, to Medicine and Islam, a program sponsored by Sharjah Television that features topics relevant both to the field of medicine as well as to the great religion of Islam. Alhamdulillah Rabbil Alameen. Today is the beginning of a new mini-series entitled Female Health, Part 4, 5, and 6. In the past, we had 1, 2, and 3 with Dr. Sawsan Al Madhi, who is the Secretary General of Friends of Cancer Patients and representative of the Sharjah Supreme Council for Family Affairs. Today, our topic is actually approach to women's health across different ages, and today we're focusing on the 20s and 30s. Dr. Sawsan, Assalamu alaikum. It's been some time since we've seen you. Welcome back.
Thank you, Dr. Bilal.
You're challenging us for the next 3 weeks with a very interesting topic. We're going to talk about women's health from the early areas of adulthood up until the end, basically.
Inshallah.
And this is something we've never done before on this show in almost 10 years, and I appreciate your insight on this. So for women to maintain good health in their 20s and 30s, what screening programs and other medical checkups are essential?
Let me first start by thanking you for giving me this opportunity again to be on your show. First of all, being 20, the age of 20 and 30, that's a very important and crucial age in the lifespan of women. 20s is the end of puberty, and at that age, the woman has become a woman, and she has finished, adolescent, and she has passed that stage. Also, the age of 20s and 30s is the age where there is the childbearing age, and that age where women actually get married and form a family. So, concentrating on these two ages, these two age groups is very important in lots of aspects. Now, there are lots of women-related health issues which comes in those two categories of age, and there are the normal health issues that comes to everyone, not just women. So, if I want to start with the women-related health issue at those two age groups, that will be, of course, some women get some period irregularities, and that's especially in the 20s because there's still the hormones is still in the imbalance stage. As you know, that is regulated by our pituitary gland in the brain. So at that stage, we're still in that area where still the hormones is not balanced, and some ladies will get that hormone irregularity, and then so the end result will be menstrual or period irregularities.
So dysmenorrhea, basically.
Yes, dysmenorrhea.
Okay.
So that is normal, but if it's continued and the lady has really bad spacing and tough or a very strong period, then she needs to go and consult a doctor.
Okay.
And we expect this to resolve after 25. So after that, she should have a normal period. If not, then again, she has to go and consult her doctor. The main issues that is there in that, which is a woman-related as well, is women tend at this age to get lots of UTIs or urinary tract infections as well. Basically, any one of us, married or not married, can get a UTI. So the symptoms of that will be burning in the urine. She wants to go frequently to the loo and pass the water. She can get some line pain. She can get some also abdominal pain with that. If she does get that, fever is not that common, but if she does get that, she should consult a doctor and again put in a course of antibiotic. And how to prevent that would be to drink lots of water. The type of underwear the lady should wear should be cotton, and also she should there is the cranberry juice. She should drink that because it has the specific quality of actually reducing urinary tract infection. That's in the general population, not just for women. The other interesting problem that women get is with the urinary tract infection, there is another infection that also not related to a woman being married or not, and that's yeast infection, or what we call in medicine candida. And that's a really common infection that any one of us can get even after taking a course of antibiotic, because what happens is you take a course of antibiotic for a certain infection, and the antibiotic not only kills the bacteria that caused the original problem, but also kills the useful bacteria, which is we call the useful flora, or the bacteria, which is basically in the bowels and in the vagina in women. So what happens is that that is an opportunity for other organisms like yeast or candida to come and invade. So this is what happens with the yeast infection. And yeast infection comes with symptoms like increase in discharge, and it's a very simple infection to treat. And as soon as a woman feels that there is something wrong, she should contact her healthcare provider.
Nagging, though,
and it is, yes, it is a nagging thing. The other interesting, and I say interesting because there is a reason, woman condition that a woman can get is incontinence. And I mean incontinence of urine. So a woman can, just speak normally, or suddenly laugh, or cough, or sneezes, and there is, small drops of urine coming out of her, which is not controlled by her. And unfortunately, this is underrated problem and underreported problem.
Right.
And
it's an embarrassment.
It's a huge embarrassment.
Yeah.
And lots of women say, well, maybe that's a normal thing. I'll just, stop talking about it. I will not speak to the doctor about it. And the other thing that makes the woman subconscious about it is the fact that we don't have that much female urologists to deal with the problem as well. So the first thing that the woman will be recommended is to go to see a urologist, which most we have men.
Almost all men.
All men.
In fact, I don't think I've ever met a female.
Yeah, almost all men.
33 years.
Yeah, that's why there is now an interesting subdivision for gynecology, and that's just dealing with that problem.
Okay.
And the problem is, what happens is with the incontinence is that because of this is a childbearing age.
Right.
And you expect the woman in that period to have maybe 3 to 4 children. And with the repeated pregnancy and delivery, what happens is that the muscle of the pelvis and the muscle in the woman pelvis, what happens is it's a little bit subluxate. So what happens is that you get those problems, which is incontinence. You can get also some uterine prolapse as well, and these are very embarrassing condition for a woman, and I know lots of ladies who don't want to speak about it.
Right.
And that's why
and the more children you have,
it gets worse. Yes, and it gets worse.
Severity also.
Yes, and it's also the type of delivery the woman with the child delivered normally, or did they have to use some instruments like a vacuum or forceps,
so
or
there was some birth dystocia. Some difficulty in delivery. That also increases the risk of having
incontinence or having maybe also a uterine prolapse, which is another condition. But again, it's as embarrassed as the first one.
Right.
So these are some of the health condition that some of the ladies can have. Now there is lots of other health conditions that a woman, and this, which is a woman-related health condition, which is like fibroids, endometriosis. Now fibroids can go undetected the whole woman life. It only starts to have a problem. Fibroid is actually, it's like a small growth in the ovaries or in the uterus, and it's not a cancer. It's just a growth.
It's benign.
It's a benign,
right.
And it can go undetected through all the period of her life, and maybe she will die and don't even know that she had it. But if it gets bigger, then that's where the problem can begin. So if it gets bigger and it's in the ovaries, it can lead to infertility. It can have she can have some sudden lower abdominal pain, If it gets bigger and it's in the uterus, or it's in multiple in the uterus, then again it can cause infertility, and also can cause heavy periods as well.
You know, this is very common amongst African American women.
Absolutely, yes.
Getting fibroids.
Yes, it getting fibroids.
Yes.
And again, it's a very easy thing to treat. Now they're doing the fibroid operation if it's in the ovaries, even laparoscopically. So again, catching it early with a simple ultrasound of the abdomen, and then treating it is the best option to go.
Now, with regards to the fibroids, as I recall, the two symptoms that actually can result in the fibroid and the uterus having to be removed is intractable pain and hemorrhage.
Yes, and bleeding.
And these are the most severe complications of the fibroids, is intractable pain that you cannot stand. And the recurrent bleeding and the threat of hemorrhage, because it can actually, the fibroid can burrow into a major vessel.
That's
once
true.
you get that vessel, you can actually bleed out.
That's true.
In a matter of hours.
That's true.
And you don't want to get it that far now.
Exactly. So regular monitoring, again, ultrasound, that will reveal it.
I was going to say, thank God for ultrasounds.
Yeah, thank God for exactly.
Thank God for ultrasounds. Okay.
Now, these are the common condition, a woman-related common condition that can happen in the 20s and 30s. Now, we need to understand that after 25, our body actually, our bone as well stops. That's it. The growth of the bone stops after 25. So it's very important before that age to get enough calcium, enough vitamin D, and exercise, because this is the age where you build your bones. I want to emphasize on bone because we have an issue here in the United Arab Emirates where everybody, not just the Emiratis, everybody who lives here actually have a vitamin D deficiency.
Yep.
So it's not just that, okay, if she's above 30, then we'll give her. It actually starts very young, and even now pediatrician has started to prescribe vitamin D for newborns.
Japan.
Yeah, so just to increase that and just prevent the vitamin D deficiency when they grow up. Again, taking it while she's pregnant, taking lots of calcium and dairy products to, give the baby the enough calcium and the boost they need after they are delivered.
Now, there are a lot of symptoms that vitamin D deficiency can cause that women and men also are unaware of.
Yeah.
What are some of those symptoms of vitamin D deficiency?
Tiredness. Depression. Interestingly, there is lots of research that's linking vitamin D deficiency with some types of cancer as well. Back pain, osteoporosis, low bone density. So there's lots of things. Joint pain as well. So there's lots of
fractures. It's easy to fracture.
If you have osteoporosis, So there's lots of things, and we don't want to reach to the osteoporosis.
That becomes very dangerous.
Exactly.
SubhanAllah. We're going to end up talking about vitamin D deficiency, I think, in our other two segments, because of course we're going to have you back to talk about the age group of 40 to 50s, and in our third segment, our third episode, you're going to talk about 60 and above and infinitum. So I think as we were going and discussing this before I actually recording, I think the vitamin D deficiency thing is going to be coming again. We're going to have to talk about it some more.
Yes, sure.
So we're back to our age group now of 20 to 30. What other things come to mind that we need to discuss in this program? Other than the fact that obviously a lot of women, when they're that young, they think I'm healthy and I don't need to go to the doctor.
Absolutely.
This is because I have several daughters in that age group, and I get this all the time. And I say, why don't you, Dad, I'm fine. Why should I go for a checkup? So how do you convince, especially with the Supreme Council of Family Affairs, what kind of projects or what kind of educational approach do you have to encourage women in this age group to get checkups and to exercise and to do all the things that you think they need to do? Because many women at that age group, they said that I'm too young to get sick, so why should I worry about it?
Exactly. Well, the interesting thing is that medicine now is going to the preventive side more, and it's not usually. Long time ago, medicine used to be all about treatment and getting medication and stuff like that. But now, medicine is going to this era where prevention is the key. So it doesn't mean that, okay, if you feel fantastic, that's great, but you should go for at least a yearly checkup. Every year you should do certain blood tests Every year you should get your blood pressure checked as well, your blood sugar checked as well, even as young as the 20s. Also, if she's married, then she should get every 2 or 3 years a cervical cancer test, which is the pap smear.
Okay.
And also at this age, we tend to teach the ladies how to do breast self-examination, so they are aware of what are the symptoms of breast cancer. They should, examine themselves every month, and if they feel anything, they should come and speak to a healthcare provider or their doctors about it. So yes, it doesn't mean that if you're feeling fantastic, there is nothing more you can do to improve that.
Right.
So again, as I said, doing a yearly blood check, going to the dentist every year. Teeth is also you have to check it even if you feel that you don't need to. Doing your blood pressure check, cervical pap smear, to do it every 3 years.
Every 3 years.
Every 3 years. Okay. Yes. Some people advocate every 5 years. Some people advocate every 2 years. I think 3 years is a good space.
Okay.
Is a good spacing.
And pap smear is a very easy and very short and quick procedure to do.
Absolutely, it's easy, it's painless,
yes.
And I mean, you get that you feel at ease when you know that there is nothing to worry about.
At what stage do you start recommending mammograms and more?
After 40.
After 40,
yeah,
okay. So
after 40.
We're not quite there yet.
No. But if the ladies actually have a family history of breast cancer, then we can actually start the first mammogram at the age of 35.
Okay.
So we're still in that age limit. We're still in the 30s age limit. So it's according to the family history. Again, if that lady have a family history of colon cancer, we would like to see her and do some special tests, like maybe a colonoscopy, some stool tests, and that's according to that relative. Let's say the relative had the colon cancer at the age of 40, then we need to see her maybe 5 years before.
Very good, very good. Now, we're just about out of time, but let's talk about the things that women should do on a daily basis. What about an exercise program? What about, it's kind of hard to start gaining weight at that age unless you really try, but it's happening. And just some last minute advice about just weight control and general exercise and attitude about, lifestyle.
Yeah. Well, every decade of our life, when we finish each decade of our life, so when we finish the 20s and we go into the 30s, and when we finish the 30s and we go into the 40s, we lose some of our metabolic rate. So what happens is that our body doesn't process food the way it used to, and hence people will come and say, well, I'm eating the same, but I'm still getting weight. Yeah, of course, because your body is not processing it the way it's used to. It's now more into the processing the food into fat, not. It's
not burning as much.
Yeah,
it's storing and not
exactly.
Burning. Yeah.
So that's what's happening.
Yes.
So what we need to do is absolutely healthy diet.
Okay.
Lots of veggies and fruits. Cut on the meat side and the fat side. Exercise, and when we say exercise, I don't want every lady to just go into the gym and you can do just housework.
Right.
Housework is exercise. Just be active.
Yeah.
Housework, instead of maybe if you're working, instead of taking the elevator, take the stairs, simple things that you can, change.
Very good, very good. Thank you so much, Dr. Sawsan. Dr. Sawsan will be back for the next 2 weeks to talk about the next age groups of 40 to 50, as well as 60 and above. Of course, if you want to write us, you can contact me at Medicine Islam, P.O. Box 111, Sharjah Television, Sharjah, UAE, or you may contact me by fax at 9716-5311-969, or at our website at Medicine in Islam at sharjatv.ae. And as our custom on Medicine in Islam, we'd like to conclude all of our programs with a short prayer of the Prophet Muhammad, peace be upon him. And inshallah, with that dua, that all sins will be forgiven, all mistakes will be forgiven. Thank you very much. We hope to see you next week. Assalamu alaikum.